Well, hello and welcome to the Mindset Mentor. I'm Tania Kolar. So, something that I always talk about here on the show is that your mindset is like a muscle that needs to be strengthened and conditioned. This is how we can live our best lives by taking charge. And so, today on the show, we're going to talk about health and wellness. Okay, so well being, of course, is so integral to living our best life, but we're also going to talk about leadership, the importance of self awareness, self care, but also being an advocate for yourself. So you got to stay tuned for this hour. We've got so many great tips for you. And I want to welcome my special guest today, Dr. Rola Shaheen. She is a women's imaging radiologist here to share a wealth of knowledge. She travels the world, giving workshops. In fact, she just came back from the Middle East. She's, spoken in Dubai and, here to share such incredible advice. So I want you to listen up. Your health is so important. Dr. Rola Shaheen, it's so great to have you joining us here today on the Mindset Mentor.
Thank you so much, Tanya. You're very kind, and thanks for having me on this show. I'm so excited. And yeah, go ahead.
Yeah, let's just jump right into the conversation. I think it's, really timely because, obviously in the midst of a pandemic, in the middle of it, as everybody was at one point, now we're at the, sort of post-pandemic and still experiencing, the trickle effect. A lot of people decided to put a pause on their health. Even when they were experiencing some issues, they thought, well, it's okay. I'm just going to wait. I'm going to wait until it's safer to do that. And certainly understandable, right, given the climate of the world. But, our health doesn't wait, does it? And so when our health is declining, I think it's so integral that we really take action as soon as possible. So I want to talk about, wellness from your perspective and what you saw during the pandemic and how it's affected how we're operating today.
You're very right, very true, Tanya, about raising this very important point. If we reflect on what happened during COVID-19 pandemic and our attitudes toward our health, it has shifted a lot. I mean, in so many ways, yes, it was kind of negatively impacting us, but there are a lot of silver lining in this. Part of it, it has raised the fact that number one, mental health is very, very important. And this is why you have seen a lot of awareness across the board, whether at personal level, at corporate levels, patient level, healthcare providers level, that now it's more important than ever that they have this kind of balanced mental health, balanced lifestyle, work kind of balance. It's very important. And the other thing that also came that came with the pandemic is the fact that mainly impacted, I would say, a lot of chronic diseases,
Mm-hmm.
where people thought it's not really that important now. Let's put it on hold. Let's deal with the acute stuff, which at that time, yes, it did make sense being a
Mm-hmm.
healthcare provider. But now we're seeing the impact. And I know you said it's trickling, but I guess it's going to be it's going to take us a while to recover from the impact of COVID-19 and what it did to our health in general. And I can't talk about this without talking about my cancer patients, correct? We've
Mm-hmm.
seen a lot of delayed diagnosis, not because it wasn't just offered, just patients were so scared to come forward and to get their screening done, delays in providing certain services. But hey, now things, as you said, are going back to normal, yet we're going to see the impact. And it's very important that we realize that our health is number one in anything we should do. And I'm not just talking about the physical and
Mm-hmm.
mental health.
Yeah, I love that you said that. So many great, things there to talk about and to explore deeper. Yes, there's been a huge shift, and I think that we all need to sort of take control and say, all right, let's empower ourselves. Let's move forward in a way that's going to serve us. I really wanted to have this conversation, and for me in particular, I was guilty of putting my health on hold. I decided during during the pandemic that, okay, well, I was experiencing some issues, health related, and I decided to ignore it. Because I thought, oh, well, it's really nothing. It's okay. I'm going to just, be positive. I'm a very positive person. But I think there's a difference between being positive and then, being a little bit or a lot in denial, right? About not wanting to hear bad news. I don't like bad news. And so I knew something wasn't quite right with my health. And yet I decided that, well, it was okay to let it go for a good while. And then I made excuses for myself. And I made excuses in the pandemic saying, oh, well, right now they're not seeing everybody. I'm going to, just wait. It's not really that serious. And so it turns out that, I did have breast cancer. I was diagnosed with breast cancer. Fortunately, I've had, treatment and a couple of surgeries, and I'm doing great. But I really want to stress the importance, of course, with your help as well, Dr. Rola, how important it is to actually get screening, get tested, check things out. Don't ignore your health because there, especially with something like cancer, whether it's breast cancer or any type of cancer, early detection is key. So I really want to encourage the listeners out there right now, if you have not been tested, if you have not been screened, well, Dr. Rola will give you more of the age. I don't know what the standards are, Dr. Shaheen, but let's help people out, because I think a lot of people go through life just not understanding, what is good health and what is, the norm, what should we do and when should we do it. So what is your advice for, the listeners out there? And by the way, when I say listeners, it's also, you may be listening and you want to be able to empower your loved one, the women in your life, to say, hey, listen, let's make sure we get this looked at, because we want to feel good, right? So what is your advice on that?
Tania, let's unpack the very important message that you
Mm-hmm.
have just actually touched on.
Mm-hmm.
First of all, thank you so much for sharing your personal story. I think it's very, very powerful.
Mm-hmm.
It's very important that to show the example of a young woman who would feel something in her breast and then totally, I wouldn't say ignore it. I'm sure it was at the back of your mind all the
Yep.
time, but
Mm-hmm.
you really wanted that kind of self-reassurance, tricking yourself, tricking your brain into this is going to be okay.
Mm-hmm.
I'm not going to worry about it. And by the way, that's a normal reaction.
Mm-hmm.
And it has nothing to do if you're a positive person or a negative person or
Yeah.
you're scared. It's more about actually the awareness, I would say, and knowing that cancer can hit at any age with no knowing. When we talk about breast cancer, Tanya,
Mm-hmm.
we
Mm-hmm.
always say, unfortunately, we cannot prevent it. But if we can detect breast cancer early, the treatment, like there's a huge chance that this can be treated with cure within the right like context, correct?
Yeah.
In certain conditions, certain patients,
Mm-hmm.
certain types of breast cancer. It's such a heterogeneous disease. If we can detect it early, that's the key. So if we unpack what you said again, importance of acknowledging that there is a problem.
Yep.
In the breast, or I would say an abnormality or something that's different, it doesn't feel the same way.
Mm-hmm.
It's very important, number one, to talk about it, whether to your family doctor, to your nurse practitioner, to a friend, brainstorming about, hey, do you think it's okay in my age, in my in like my condition, my risk factors? Just get a second opinion. Just go and just talk about it with a healthcare provider, and
Mm-hmm.
they can guide you. Now, you mentioned the age. The age, as I said, breast cancer mainly affects, the older women, correct?
Mm-hmm.
This is what we always say, because these are the main risk factors, being a woman and getting older, correct?
Yep.
But does it affect women in their 20s, 30s, 40s, 70s, 80s? Yes, it does. But as we can't just offer mammograms for the 20-year-old and the 90-year-old, correct? In a public health setting, in an organized program, we have to kind of put limits that we think we can catch the most eligible population and
Mm-hmm.
the population at risk that's going to be affected and impacted by breast cancer. So in the Ontario Breast Screening Program, women who are eligible for screening with the screening mammogram starts at the age of 50, goes all the way to the age of 74. Does that mean if a woman under the age of 50, if she feels something or if she wants to get screened, can she? Of course she can. And I think, and I highly encourage those women who live in Ontario to go ahead and discuss the risks with their primary care physicians, with the nurse practitioners, to get that screening done and to know what else can be done. Don't forget, there are women with high risk, correct? The positive, strong family history, genetic predisposition.
Mm-hmm.
It's very important to know what's my risk? What's my lifetime risk to get breast cancer? So to put it all together, Tanya, I would say know your risk, learn how to know what's the normal appearance of your breast, how the normal feel of it. If it doesn't feel right, regardless of your age, seek medical advice.
Oh, that truly is amazing. I love everything that you said there because it really is so important to seek, the help of a medical professional, right? Certainly, we can do our own research. It's always great to be empowered, or we hear other people's stories and we think, okay, well then that's okay for me too, right?
Mhm.
So I'll give you an example. In my own situation, I had a friend who had some nipple discharge, right?
Mhm.
And she had seen her doctor and they had said, oh, don't worry about it, it's normal. When they did all the testing, they said it's hormonal of some sort, right? Let's say
Yeah.
I'll just equate it to that, just as a
Mhm.
general thing. And so, fast forward to my situation, I had a lot of changes in my breast and I ignored them all. Not that I ignored
Mhm.
them, I decided that I was going to again, just decide that it was okay, right? And that I chose that, oh no, I'm sure it's nothing serious. I had a lot of changes in my breast. And one of the symptoms that I had as well was nipple discharge, at some point. And again, I decided that, well, it's okay because that happened to my friend and they said it was hormonal. So it's really
And it
not
was
a big
okay. Yeah.
deal, right? That's why, when you say, yeah, you really need to get it checked out, I couldn't agree more. Early detection, as you said, is so, so key. And for me, I know that when I first initially felt that I had a lump, I should have gone. I thought, well, it's not a big deal. It's common. It's probably nothing. And then it grew and it grew and it grew. And then I ended up having late stage 2 cancer. Now, I mean, fortunately, in my situation, I got the help that I needed, and I'm feeling great. But again, that could have taken a really awful turn if I continued to act the way that I acted, if I continued to ignore the situation. So, self-awareness, I think, is really, really integral. We need to step up in our own care, so that we can facilitate the next steps, right? So I think, these kinds of conversations are so instrumental in helping others, just because life can get busy and I think we get locked into a pattern and we just don't have time for things, or we're just not ready to deal with it if we think there's something that's going to be
Mhm.
bad,
Mhm.
right?
Mhm.
And so I love these conversations. And one of the things that I experienced, that actually I found quite surprising, was the statistics of how many women have cancer, breast cancer in particular. I was shocked that there's that many. Can you share a little bit about that?
Sure. Tanya, can I just also go back one step
Yes.
back
Mm-hmm.
to some factors contributing to delaying the diagnosis and what happened with your important story?
Yes.
Uh, you mentioned that self-awareness, but there is an international barrier that is known across the world, across the globe amongst women, which is fear, correct?
Oh, yes. Mm-hmm.
So
Mm-hmm.
I just wanted to acknowledge that fear is number one factor that would prevent women from going when they know that they have something,
Yeah.
especially if that thing doesn't go away after their menstrual cycle is gone.
Mm-hmm.
And just like we have to share with them, with the self-awareness, the fact that most of these symptoms, probably of course not in your case, most of these symptoms are usually ending up being a benign cause or nothing.
Mm-hmm.
So this is where we can break all the barriers about fear. Go forward, get that checked. In most of the scenarios, it's going to be benign. I know, unfortunately, in your case, Tanya, it wasn't, but
Mm-hmm.
I would say 90% of those findings are going to be benign. So back to now that you like statistics and numbers, I would say yes, you are correct. Breast cancer is the most common cancer affecting women at global levels.
Mm.
I would say, of course, after like definitely, there are other most common cancers such as skin cancers in some countries. Lung cancer is on the rise, but definitely in most of the countries, breast cancer is number one. But also, breast cancer is in terms of getting treated and lower stage, like responsive to treatment, is the highest cancer in our province. Like
Mm.
once it's detected, there is a treatment. Correct? It's a disease that can be treated. Women can have a high survival rate. The quality of their lives are going to be amazing. Like it's so I would say yes, it's very common. I don't want to scare people, but definitely women need to go forward and get checked for this because it's there's a solution for it.
Oh my gosh, I couldn't agree with you more. And you're right. Fear definitely is a factor that it's fearful, and you think, oh my gosh, what is it? What could it be? And the mind sort of takes over. But I can tell you from my personal experience, once I knew that I had cancer, it was actually almost like a huge relief because now it was like, okay, now I'm ready to face it. Now I know what the next steps are, right? And then it took that fear away in a sense, right? And so it's so important to take action, right? Take action in our health.
Navigate the system. Yeah.
Yes, navigate the system. And actually, we're going to talk about how to navigate the system when we come back. We're going to take a short break here on the Mindset Mentor. Dr. Rola Shaheen is joining me today. She is a women's imaging radiologist, and she is helping us to, take care of our health. She's helping us to empower ourselves. And we're going to talk about leadership as well when we come back. Stay tuned. We'll be back right here on Sauga 960. And welcome back to the Mindset Mentor. I'm Tania Kolar, helping you live your best life. Yes, it is possible. Yes, you can do it. And remember that you were born into an extraordinary world, and that means that you are an extraordinary being. So let's live our best lives. All right, so we're going to continue the conversation with Dr. Rola Shaheen. She is a women's imaging radiologist, providing some great information and sharing, her experience when it comes to health and well-being and how we can empower ourselves to be better and to take action, right? To be proactive in our health. So just before we took a break, Rola, we were talking about navigating the system. So what does that look like? How can we navigate the system? Because I feel like there's so much information, it can get a little overwhelming. So where do we start?
Thank you, Tanya. I guess it all starts in the room when the patient gets the bad news that she has something going on. You know what I mean?
Mm-hmm.
Until now, I say as a breast radiologist, I never find it any easier when I go in and I have to tell a woman that she has an abnormality that needs biopsy. The look in her eyes, it's, I would say, across the board would be always like very, very concerned, let me
Mm-hmm.
put it that way, and worried about, and some, of course, are confused. But once you explain to them what's going on and how is that going to help getting us a diagnosis, they will go with it. But then from that moment, you really have to help the woman to understand. Maybe she listened to 90% of what you said. Did she digest it?
Mm.
Does it make sense to her? That's such a high anxiety kind of situation where we really feel as a provider, as health providers, that the patient needs all the support. So that's why I do feel in good cancer care centers, there should be a team that would tackle this through a breast navigator. The breast navigator role usually would be to help the patient understand the system and navigate the system. When is she going to get her pathology results? Who's going to convey the pathology results to that patient to tell her that she actually does have cancer? And is she going to have a surgery first, or she has to be referred to an oncologist to get chemotherapy? Is she going to see a radiation oncologist uh, person who would give her the radiation, and when is she going to get that? Does she need a plastic surgery afterwards? How about her mental health? How about the other family members? As you know,
Mm,
cancer is not just impacting that single patient, it's the disease that impact the whole family, let alone if it's a young woman at her prime age, it's going to affect her work, the children, the husband, the sisters, the mother, the partners, like you name it. It's a disease that would impact everybody, and that's why understanding what are the next steps is huge. Sometimes social workers are involved. I would say even nutritionists. So it's very important to have a point person to go to, and that would be the breast navigator who would help refer that patient, especially in Ontario. This is like a very well-known job.
mm-hmm.
I probably will start by referring the patient to a breast surgeon to get the patient examined to decide if the surgery is the next step versus the treatment with oncology. The patient may need further imaging, correct, like breast MRI before the surgery or before the treatment. A lot of factors there, and unfortunately, this is all new to the patient, correct? And probably they are not even like they're not into the medical field, or they don't even have somebody who worked there. Some women, some don't know even how to get into the system. So it's very important to have to advocate for the patient. You have to have patient advocates.
Mm-hmm.
It's important to have somebody to talk to you about their own experience. As you said, maybe you talked to your friend, she was okay, but also it's helpful to talk to other patients or other survivors who can guide you through this. Did you ask about this? Did you get the genetic testing? Where like there are a lot of things that you can learn from the patient herself. They can do their own research, and we need to respect that as healthcare providers. Um, Again, the good news is a lot of cancer, we do have a lot of facilities and hospitals that have this kind of multidisciplinary circle of care that would like figured out with guidance on where the patient would go in that journey with checkpoints. And hopefully, and we do have a system, correct, under Ontario Health that would even measure our performance and just
Mm.
make sure that certain wait times are met and indicators are met to protect the public, to protect us, to see who needs help, correct? So it's a huge, big thing. But again, I think we got it all figured out here with a lot of challenges, I have to say.
Yeah, well, it's like trial and error, right? This is a process that certainly has developed, over a long period of time, right? So there is an art, I think, and a science behind it all. It's very,
Evidence-based, no, I assure you.
yep. Yeah,
Not
exactly.
trial and error, not trial and
Yeah,
error.
yeah, yeah, evidence based. Yeah, exactly. So, but it's interesting because yeah, there are so many steps, but I can remember thinking, wow, I mean, yeah, they do have this down to like a science. It's like, this is the next step and the next step and the next step, right? And I think that it really is so important to have that knowledge, and knowledge is empowering for sure.
Absolutely.
Yeah, and I also agree with you in how important it is to talk to other people who have gone through the experience. I know several people had reached out when they found out that I had,
Mm.
breast cancer. So friends, even acquaintances, just reaching out and say, "Hey, I've been through this, and let's have a conversation." And I loved it. It was great, and it just was like, "Hey, I really appreciated that." And now, I've also put myself out there in the situation when I find out that someone else is going through it. Hey, let's talk. Call me. I'm happy to have a conversation when you're ready, right? Or I'll reach out and say, hey, like, I'd love to help you and support you in this. I think it's really important to support each other in any way that we can, not just going through physical health, right? But just in life. Our support system is very essential. So I think it's always good to check in with your tribe, right? Surround yourself with
Mhm.
people who empower you, who can help you to be your best self. If our environments are not conducive to us thriving, it really is limiting. And I know sometimes it's not possible, right, to surround yourself with your top choice of people all the time, right? Just family dynamics or what have you, or if you're living with people that just are not necessarily that supportive, that can be challenging. But find some type of a support system for yourself. Reach out, and that could actually even be reaching out to a support group in the case where you feel that you don't have that circle right around you. So let's talk about some of the support and what you've seen in your career with how people have thrived, having a support system.
Uh, Again, another great point, Tanya, because patients, as you said, yes, they can reach out, they can do this, but honestly, sometimes they're too overwhelmed,
Mm-hmm.
they're too tired, some get depressed.
Yep.
So I think we shouldn't just rely on the patient finding and navigating or figuring it out on her own.
Mm-hmm.
So that's why the support should come from within the circle of care, like the clinical care. They need to kind of have the right eye to figure out that this patient is not really getting the support that she needs, whether from, as you said, due to certain family dynamics.
Mm-hmm.
People have different backgrounds, different stories. Don't forget the new immigrants. We're an immigrant country. People have language barriers,
Mm-hmm.
cultural barriers. All these need to be addressed, and we need to be very culturally sensitive when we address these type of things. And that's why, again, as I said, a lot of facilities, healthcare facilities, do have guidance on support groups, whether it's from survivors, whether it's for nutrition, whether it's for well-being. And that's the benefit of COVID, where they really now prioritize the importance of taking care of our mental health, whether it's for at patient level or care
Mm-hmm.
providers. And I would say even care providers will need that, like not just the patients. Also, we need to, as I said, respect patients' wishes, patients' autonomy. Sometimes patients, you do come in and you put the plan, and as you said, as evidence-based doctor, well-trained, you come in and you give her the plan. This is what we need to do. But you know what? If patient doesn't want that, or if she's questioning this, we have to respect this. She needs a second opinion.
Mm-hmm.
That's the support by giving that patient a timely referral to an expert. It doesn't make you any less of a physician. It's actually it builds trust with your patient. Make sure that you respect cultural things, such as people talk about now, Tanya, alternative medicine,
Mm-hmm.
correct?
Mm-hmm.
Some people don't want to have certain treatments, and in the past, like when I was the younger physician, like I'm just going by the book. But now you see patients going alternative pathways, and they're happier with it, or they're
Mm-hmm.
happy, or it works in sometimes. I mean, I'm not the expert, but I have seen patients, I have seen friends and relatives diagnosed with cancer and made different choices, completely different than what goes in the book in the evidence-based medicine. So all this kind of support with the different, I would say, ways need to be like well thought, and you need to be thoughtful when you're approaching your patients, and having an open mind. Not everything is black and white, even in medicine.
Yeah, I really can appreciate you saying that, because for me, I chose a hybrid approach to my healthcare, right? So I did some of the traditional, therapies. I did chemotherapy, and I had I augmented it with supplements and nutritional therapy, and it was kind of interesting to see, who on in my circle of medical care was on board with my decision, and who were really trying to change my mind. And I respected both. I understood exactly why. It's like that's what they're trained to do, and I know that they're coming at it with the best of intention, for sure. But I also knew how important it was for me to really tap into what feels right to me and my healthcare. Because also I think that I kind of went full circle from being in denial, in a sense, and not wanting to deal with it, to, hey, I'm taking this head on.
I'm in charge
Right?
now. Yeah.
I am in charge, and it felt great to be in charge, right?
Mhm. Absolutely. You need to be empowered to do so. You need to acknowledge what you have and have the full insight of what you're getting yourself into it, and have an understanding. One of the things that I find that kind of, I wouldn't say sad,
Mm-hmm.
I'm not sure what's the right word, when patients hide what they're doing because they're worried and fear what their healthcare provider is going to think of them. Are they going to judge them? Maybe
Yeah.
they will stop treating them. Maybe that, you know what I mean?
Yeah.
So I do feel right off the bat, this kind of trust between the patient and the healthcare provider need to be built. And you know what? Some patients are very good advocates about themselves, and
Hmm.
some they don't know what to do and how to say it. But I would highly encourage women and patients to have that kind of open conversation and not to fear what they want to do. And if they have done something, actually, it's in their best interest and benefit because you don't know some of those supplements, Tanya, may have
Hmm.
drug interaction, correct? And your
Yep.
doctor will know and will guide. And if they don't know, they can do the research, correct? Like
Yes.
they will know where to look for you.
Hmm.
As you said, maybe they will not impact your decision on whether you're going to take them or not.
Hmm.
But you need to know what you're getting yourself into it, and that should be the job of your doctor to help you get there. In
Yes.
my opinion, don't forget, this is all my opinion, Tanya.
Well, it's great. Listen, I'm loving it, and it's great. And I think, listen, we all have our opinions of what makes sense to us, and it's so important to listen to that. Though, do your research. Be empowered, get the knowledge out there. So I love that, and to your point as well. I know that yes, I was on. Several different supplements and obviously a lot of different medical drugs and treatments for the chemo and the drugs before the chemo and after all that. So yeah,
Mhm.
they also wanted to know exactly what I was taking, what the ingredients were. I had a nutritional counselor coming in and going through everything, and the pharmacy as well. So I mean, they're checking and it's great. But again, you have to make a decision for yourself with all of the information that's there.
Given to you on the table, correct?
Yes, yes, yes. And it's funny because, you were saying that, you have to be honest with, what you're doing. And it was so funny because I remember at one point thinking, oh, maybe it's just easier if I just say, oh, I stopped taking it this week. You know what I mean? But I was like, no,
Mm.
that doesn't make any sense because I have to be honest. They need to know. Because at one point I know that my white blood cell counts were quite low. And so, the question was, well, are you still taking those supplements? Maybe it's the supplements because they weren't really quite sure why they were so low. But I was honest and, and then I just made that decision that I'm always just going to say exactly, what it is that I'm taking because everybody needs to be on the same page, right? So important.
Absolutely. And it's your right, correct? It's your right to have that holistic approach of care.
Yeah.
It's your choice. And
Hmm.
again, there's no right or wrong. And if you are aware of the benefits and the harms, and you made the decision to go with it, you will take the full responsibility, correct?
Yeah, 100%. Absolutely. I love that. All right. Well, we're going to take a short break and we're going to continue with more health and well being. And we're also going to talk about some of the symptoms and what we can look for when it comes to our breast health and moving forward. Stay tuned and we'll be back here with Dr. Rola Shaheen. Welcome back to the Mindset Mentor. I'm your host, Tania Kolar, helping you live your best life. Today, my special guest is Dr. Rola Shaheen. She's a women imaging radiologist and helping us to foster better health and well-being. We could always use a boost, and we've got some great advice here today. So we're going to continue the conversation. I'd love to talk about some of the symptoms, what we can look for in terms of our breast health, and then I also want to talk about the future of medicine and where we're heading. I mean, certainly there's been so many advances in medicine, so we're going to touch on that. But let's start, Dr. Shaheen, with some of the symptoms. What can we look for?
Thank you, Tanya. I'll start with the most common symptom, correct? And that's breast lump. Women
Mm-hmm.
with, that's the most common symptom. And most of the time, luckily, there is no lump. It's just their breast tissue when they come for imaging
Mm-hmm.
or when they go even to check it with their doctor. But definitely, if you feel a lump, it's a reason that you need to seek medical advice. One thing I need to talk about quickly and very important is the breast pain. We see a lot of women coming in with breast pain that's diffuse, that's probably related to their menstrual cycle. They need to be reassured, correct? This is not, I would say, in 99.9, not breast cancer. Breast pain can be a symptom of breast cancer, obviously, but when it's um, really localized, it doesn't go away after the menstrual cycle is gone. And it's associated with other symptoms like, changes in skin, pulling, like, what your normal breast would feel like, correct? That's very important. So I would say yes, breast pain is one of the symptoms, but definitely it's on the very, very low on the list. The second symptom would be nipple discharge or lump even under the axilla.
Mm-hmm.
Skin changes, looking like, the poudron, like they said when it's the skin looks like the peeled orange, like
Mm-hmm.
the
Yeah, the
yeah
skin, that
the
skin
skin
orange peel. Yeah.
that's
Mm-hmm.
fenestrated a little bit.
Mm-hmm.
Uh, that's actually, I would say, probably even a late stage. Like definitely the woman would have probably other symptoms before she feels that. The change in size of the breast,
Mm-hmm.
like when you have an asymmetric difference, all of a sudden the it's getting bigger, more inflamed, redness, or it's even if it's getting smaller and hard.
Hmm.
That's when you worry that there is something going on. Um, like again, every woman is different, correct? And they will
Yeah.
have different symptoms. Sometimes even eczema around the nipple itself. That's
Hmm.
Paget's disease. Need to be checked. A skin biopsy need to be taken.
Mm-hmm.
So a lot to watch for, but I would say anything that's not the normal self that you know about the breast, just get it checked. Even with the breast pain, go to your doctor, get it checked. But maybe you don't need to go all the way to get the ultrasound and the mammo and if provided that you have gone through all your routine screening and
Yeah.
imaging.
Yeah, really good. Interesting. Something that you said that I thought, I see. I never would have thought that that would be a thing. Is that you said if even if the breast looks smaller, right?
Mhm.
I thought, oh, okay. You'd be thinking, oh, that's why is that a big problem, right? So interesting, though, right? It's really good to know these things and what to look for. And we hear a lot about breast density lately.
Mhm.
So can we
Mhm.
touch on that a little bit?
Very, very important. And now like it is an important topic in south of the borders, like in the States. Like if you're dense, you need to have supplementary kind of tool for screening. If you have a dense breast, chances are that your mammogram will be more challenging to report. It will be higher chances to miss cancer.
Mm-hmm.
Women are even known are found to be at higher risk to develop cancer if they have dense breasts. So that now it's important for women to be aware
Mm-hmm.
and know what their breast density is and what sort of supplementary screening is available there for them, which can be suggested by their primary care physicians. It's very important to have that kind of discussion. And this is where probably a good segue for the future. There's a lot of emerging technologies, Tanya, that we are available now in the market. And luckily, we have them available here in Ontario, such as, I would say, contrast enhanced mammography. Women are also getting breast MRI for screening. However, as I said, in certain conditions such as high risk, there's a lot that can be offered to the woman. Knowing your risk at personal level, like going through precision medicine. This is where we're going. Artificial intelligence is actually a fascinating, hugely fascinating field. And I always say radiologists who don't use AI maybe end up in 10 years not having a job. So it's very important to understand
Yeah.
the importance of artificial intelligence. Probably that's what led me to do my executive MBA in healthcare and life sciences and learn more about this. But luckily, I found out no, we're still going to have a job in 10 years as a radiologist. At least that took care of that.
Yeah.
But the future is amazing, and I'm sure we will have more personalized medicine tools that will help women make more informed decisions, getting earlier diagnosis, better treatment, more effective treatment that have more that will not impact our quality of life. It's not just about living; it's how you live. Correct?
Oh, yeah, you couldn't have said it better. I absolutely love that. Truly, the quality of life is essential, right? And it's interesting, all the technology, and and I can't wait to see the next, integration of more technology and the AI as we continue to advance, the sciences continue to advance, because I think there's been a huge shift and difference in being diagnosed 20 years ago, just even 20 years ago, right, versus today, and the tools that are now available, the techniques, the advance it's remarkable. And I think, and also and less invasive, I think, way as
Hmm.
well, right? So I love your background in the life sciences, and what you've seen. And have you noticed a change, throughout your practice, on how you're treating patients with the knowledge that you have now?
One important change, or I would say shift, that I've seen in the past years is the fact. I'm not going to just focus on beside technology because
Yeah.
that's obvious. But now I think what's making a difference is actually the patient is sitting at the table of decision making. More
Mm.
and more, we're seeing involving the patients in the decision of care, and empowering patients with the information that is now available with, everything now is with Dr. Google, everything is there, correct? So
Mm-hmm.
not only that, but also we have to filter this kind of knowledge for them, what's relevant, what's not relevant, what's important, what's not. And it's having that patient sitting at the table right off the bat, not just when that patient gets diagnosed. It's actually from planning the whole thing, having the strategy to build the cancer care, uh, all from A to Z. I see that patients and diversity, attention to diversity with the different cultural backgrounds, different beliefs. Everybody now is included in that kind of decision. And I feel this is going to add a lot of years of good quality of life for many cancer patients and in chronic diseases in general. So the more we include patients in their own health, the more they will take charge, the more will be motivated to improve it for themselves and for others. Look at you, what you're doing right now.
Oh, well, thank you. Listen, I love this conversation. I love everything that you said. And, it's so true that we do need to be empowered and feel as though we're, in the process, sitting there at the table, getting the help that we need, listening with open ears, but also having a voice and speaking, right? And advocating for ourselves, so great. And unfortunately, we're out of time. So, Dr. Shaheen, I want to acknowledge you for the work that you're doing. And I got to say that, I was blown away by the medical team, where I was, experiencing my treatment, and going through my journey. But I think it's such a tough job, especially in this global climate that we have, to do what you do, and to have to deliver the bad news. I remember when it was the surgeon who actually gave me the diagnosis that yes, it is breast cancer, and I actually felt really sorry for him that he was the one to deliver the news. I was like, oh, that's got to be tough. Like, you know what I mean? Like that's tough, to do. So I acknowledge you for the incredible work that you're doing.
Thank you so much, Tania. Yes, it's not an easy job, but that's why healthcare providers need to find ways to keep that kind of balance. And I wouldn't say detached. We have to stay there with our patients, feel for them, and
Mm-hmm.
feel with them, um, and figure out ways to cope. I would say to cope and keep going and progress.
Yes, to keep going and to progress in life and to make sure that we all take care of our health and well being so that we can truly live our best lives. So, again, that's a wrap for today's show. So, thank you so much to Dr. Shaheen for joining us. And thank you to you, the listeners, for tuning in. It's always my pleasure to be here with you. And I look forward to chatting with you all next Thursday at 3 p.m. And if you want to watch a video of today's show, take a look at my YouTube channel at Tania Kolar, and you can get deep into the conversation with us.